Hi, my name is Eliana. I will be going over the economic factors contributing to non-communicable disease in Asia. Terms associated with this report are non-communicable disease, urbanization, trade liberalization, and importation. Non-communicable disease, otherwise known as NCD, is a disease that is not caused by an infectious agent. This includes diseases such as cancer, diabetes, cardiovascular disease, and respiratory disorders. Urbanization includes uh, typically a rural geographical area that is becoming more urban or city-like. Trade liberalization is the reduction of or removal of restrictions on the free exchange of goods between nations, and importation is the importing of goods or services into a country from abroad for sale. So trade liberalization and importation are very similar. They have a lot to do with each other. So what's the problem? According to the CDC, non-communicable diseases are responsible for more than 68% of deaths worldwide. In Asia, non-communicable diseases claim an estimated 8.5 million lives each year. 1/3 of these deaths are premature and occur before age 70. With the staggering number of individuals affected by non-communicable disease, it will become a further issue for the future of Asia's population unless something is done soon. Prior research investigates elements related to genes increasing risk factors. Increased risk factors should also include behavioral risk factors such as smoking, decreased physical activity, or eating unhealthy foods. Prior research also investigates economic factors individually rather than in combination. By investigating these factors individually, it has created a gap in research that is imperative to finding a solution for policymakers that includes the three of these things that are causing such an issue for Asia. So the research question that is prompted based off that gap is analyze the economic factors contributing to the prevalence of non-communicable disease in Asia. The answer is there are three primary contributing economic factors which lead to a higher prevalence of non-communicable disease in Asia, which include trade liberalization, importation, and urbanization. The aim of my study was which economic factors contribute to non-communicable disease, how to bring further awareness to policymakers in Asia about how trade, importation, and urbanization has affected the population in combination, how implementing a policy or policies to control the three primary factors can help Asia as a whole, and in how to inform the population on how their own health behaviors affect the risk factors for non-communicable disease. Three assumptions are importation and trade liberalization allow for access to unhealthy foods and goods. There was a quote in my report stating, liberalization of trade has implications for the structure and nature of food systems, its availability, quality, accessibility, price, and promotion, meaning that this has allowed trade liberalization and importation have allowed such, terrible foods and its availability, its quality, giving it further access, maybe even a price decrease, making it cheap for people to be able to afford that. Urbanization should include a transition phase to decrease effect of such drastic environmental changes. My quote here is urbanization leads populations to shift away from previous occupations such as physically active work, including farming, mining, and forestry, and incorporating inactive occupations such as behind-the-desk job. Typically, behind-the-desk job are associated with decreased physical activity, which has been an issue. Lastly, generally speaking, the poor are those who have less access to healthcare and have better health. On average, in urban areas, more affluent than rural areas had more households experiencing the burden of non-communicable disease, but also more households with healthcare coverage. So this is interesting because you would think that usually the more rural households, or the more not necessarily poor, but less, I guess, wealthy households would have a higher prevalence of disease, but it's actually the other way around. It's the geographical areas that are more urban and that even have healthcare coverage to be seen have more disease. Erasing the traces. So I had a significant hardship writing this report without integrating cultural influence and how it could differ within the many countries of Asia and how these influences can specifically affect an individual's health. And this could have a lot to do, with work or with exercise or with just even the way their eating habits. It could have, so much to do with that. And it was difficult kind of trying to keep that in the back of my mind and knowing that that was definitely, an issue there. Last implications is next. Trade liberalization and importation. They both allow easy access to unhealthy foods and goods, which increase risk factors for non-communicable disease, such as obesity, cancer, urbanization, causes or is associated with limited physical activity, increased behind the desk occupations versus physical work. Recommendations are policymakers should improve laws that promote easy access for goods and limiting those that are harmful. Further attempts should be made in order to transition rural geographical areas to urban areas. Further education should be made to the general population on how lifestyle impacts their health. So where is this research applicable? Research is most applicable to public health policymakers throughout the countries in Asia. Policymakers have the power to address factors contributing to increased non-communicable disease. Research should be used as another piece of the puzzle that fills the gap between what is known and what should be known.